This is the most dorsal part of the scapula. So your shaving is gonna have to go beyond midline dorsally, and also beyond midline ventrally. So the most of the chest is shaved all the way to the other leg, and in front and in back. So make a big shaving. All right. So this is the dorsal aspect of the scapula. I'm gonna go a little bit beyond it, and then go on the spine of the scapula. And this is a cadaver, so things look a little bit different. Go on the spine of the scapula and incise it. Kind of, this is the end of it. And now you're gonna make kind of a Y almost incision. And usually we have somebody helping hold the leg. And this incision can be somewhat circular, or it can end up with a tip. You're gonna incise here on the spine, right on the top of the spine of the scapula. If you go in front or in the back, you're gonna get the supra or infraspinatus. So there's the incision, and a pretty superficial incision. I'm gonna try to find those muscles. The omotransversalis and the trapezius insert on the spine of the scapula, and as I go right in the middle, I will show you them. They're not super thick, and if you incise right here, you will get them. So now you're gonna go cranially and caudally, and remove them. All right. So I'm gonna detach here from the spine of the scapula. So now here's the muscle, here's the trapezius, which I'm gonna have to cut in this direction, and the omotransversalis cut in the cranial direction in order for us to free them. And I'm gonna dissect just a little bit more than we usually do on a live dog so you guys can see better. All right, so omotransversalis and trapezius. So now I'm gonna cut it to give me a view. And we use a lot the cautery, because if you cut muscle, it's hard to see. So now we have free, and you can incise here and free the omotransversalis a little bit more. We'll do all this with the cautery. All right, now we're gonna go to the medial muscles of the scapula. So imagine this, if I had gone, this is the spine of the scapula, all right? And if I had gone deep, either in front of it or in the back of it, I would end up dissecting the supraspinatus or the infraspinatus. So that's what you guys have to do, the incision right there, right on the spine. If you feel you're dissecting in between muscle and a wall, it's because this is the spine and you went too deep. So incise the muscle and then come dorsally. Make a little pocket and feed your finger so you can see that this muscle separates very easily. We will use the cautery. So I'm gonna pzzz and pzzz, because it bleeds much less, all right? So go really close to the bone. When I started doing this many years ago, well, we would use the AO periosteo elevator. Both the rhomboides and the serratus ventralis were detached from the scapula, and that gives me the ability to do this, to pull the scapula, to abduct the scapula. Now, this is the back part, the caudal part of the scapula, and we're gonna get the latissimus dorsalis and cutaneous trunci muscle, which I cut already a bunch. And we go close to the humerus. So now that we did this, it allows me to pull the scapula, to abduct the scapula. So there are gonna be a bunch of nerves here. The whole brachial plexus is here. And I'm gonna try to peel, we use a lap sponge or we use a Mayo. So I'm dissecting here. And you guys probably can see the vein around. And you can, if there's a nerve, we usually block. So there's a nerve here. And then you infiltrate the nerve with just about a few, and as you can see, it makes a little bubble there. And then give a few seconds, and you cut right on top of that little bubble. All right. Try to avoid dissecting too deep in direction to the thorax, so you won't cause a pneumomediastinum. So let's ligate the artery because it's right here. It's easy. This is the artery. All right, that was the nerve that I cut before. So either you do one at a time or pass a loop. And now you split in two sizes if the silk is long enough, okay? The distal is the one that's gonna go with the leg. You just don't want anything bleeding. All right, so I did this on the proximal, and I'm gonna do the same thing on the distal. And then before I cut, I'm gonna do a transfixation. And this is gonna be on the side of the dog, all right? So now you put a little hemostat here, like a little stay, so you can see. So once I do my transfixation, which I'm gonna do distal to and you are welcome to do 2 ligatures. Once I do my transfixation, I'm gonna cut, leaving a little bit longer on the side of the dog, because it's the side that you are concerned, and a little shorter on the leg. So I come here right through the vessel, and it's gonna bleed a little bit, just a little bit, a little drop. It's gonna come out in a live animal. Trying to make a square here. Double throw again. Also do your best to do a square. And now we finish up with 2 throws. So we cut a few half a centimeter, and then we cut either the vessel or cut here. Leave that guy for now, and I'm gonna cut here and cut the vessel. You hold the vessel gently, and you come here. And as I told you, I'll cut a little bit closer to this guy, giving a little bit extra here in case it bleeds and I have something to grab, all right? All right, so of course in the live animal, it's super obvious to see. This is the cranial wall of the vein, and this is the caudal wall of the vein. So we go in front and try to dissect well in this direction. So free pretty well, so you have space to dissect the vein and to give space in between the ligature that's gonna stay on the dog. And see, this is the vein here, cranial and caudal wall, there and there. So you're gonna have space in between your ligature and your transfixation. All right, until you have a nice wide area there, all right? So there's the vein. Here we did 2 encircling. These are the 2 guys here, and we did a transfixation. And again, I hold is the vein, and I hold it, and then I'm gonna cut here a little bit longer on the dog side, and then no bleeding, so we're good. We tend to leave these guys long so you will see it, so you guys can see and not screw it up. So now what we're gonna do, so we got the artery and the vein. So now what we're gonna do, we're gonna clean this area, find the nerves, and block them, the big ones. The little ones we tend not to block, and then cut them. So we come with the cutter like this. I use the cutter instead of the cutting, and I really move as they cut. Then we move around. Maybe. So pectoralis muscle here. All right, we're gonna cut here around the leg. And you can preserve some, especially if you have a tumor or it's a trauma, you can preserve some so it will help you the closure. It is a little ugly when I'm doing this because it kind of feels bad. And there's usually is a little bit of a vein here, so the cutter makes this bleeding much less. Now we have the cleidobrachialis muscle there. Oh, sorry, that's not yet. Cleidobrachialis muscle is there. It's a pretty lean muscle. I'm gonna see if I can find so putting our hand underneath and identifying the muscle helps. All right, so I didn't cut the brachial plexus completely, just so you guys can see. There's still some nerves. Sometimes I leave it like that, and you can flip the leg, make sure where your ligatures are, and make sure that you're not screwing it up. And then identify the nerve, infiltrate the nerve, and then cut it. And if you're concerned, somebody can hold it here, but your ligatures are here, so you don't worry about that. All right, so now you get the leg out. So we end up, try to, as you make the incision, so it's not a straight line incision, but at the end, I'm gonna show you kind of how to suture. At the end, you're gonna have something like this. There's really no absolute set of ways you're gonna do this. Just what we're gonna try to do is, remember, there's gonna be a big dead space there. This is already being lavaged. There's no blood coming out, you see that. And then you're gonna close. And we're grabbing most of the fascia because the muscle doesn't tolerate tension. So again, I'm getting the deep, the dorsal is here, ventral is here. Getting the deep part of the muscle. And the goal of this is putting these muscles together, decreasing that space, avoiding that fluid accumulate to have a big seroma. That space still exists, so we can tackle the muscle down. As you can see, I'm still going on the deeper part of the muscles. And then I tackle it down to put this layer of muscle together with the thoracic wall muscles, which is gonna be, you know, serratus and the scalenas and intercostals and such. You come here and you put them together, and it helps your decrease in the dead space, all right? Who can change? Who has the power to change that? Well, the dean should have the power to change some things, but the dean just can't. Somehow, it's not that somebody says to the dean, "Oh, you can't do it." And then, how about the provost or the president of the school or whatever? So we're gonna suture now the superficial face or the lateral face of the muscle. Interrupted is fine. It takes a little longer, and we do a lot of amputations in oncology, and as you might imagine, that gets boring. So I do it simple continuous for the sake of time. So I go under the muscle in between that and the chest, pretty dorsal, and I'm gonna make an incision, push it against the skin. Gonna make an incision right on top of it. Reposition there. And you have to push it. All right, now we open it up, and again, this is red rubber, which will work. So what we would do is, if I didn't have a pain diffusion catheter, which costs about, I think, $12, I would make hundreds of holes with a syringe on this guy. On the pain diffusion catheter, the soaker catheter, you don't see the holes, they're too tiny, but then you see the black mark that goes all around. That black mark tells you that the holes are gonna start just beyond that. So no holes here, because the black mark is here, the holes are gonna be here. So now I pull this thing in, all the way that it covers all the incision under the muscle, in between the muscle, so the nerves are gonna be here, and the chest. So all right, now I can close the muscles. In this particular situation, this will become a dog here. You don't have to cut it, but you can, and you look a little bit better. I'm gonna continue this curve. And of course, I don't think it's gonna be perfect, but I'm gonna cut the excess, and you can finish up with the scissors because it's easier. And then it ends up being a little bit better.